Good afternoon. I wanted to give you a brief update on COVID-related data and some issues associated with our ongoing response. It is Friday afternoon. Currently, the Dutchess County Department of Behavioral and Community Health is monitoring 752 active cases. Now, that's up 26 cases since last week's report when we got together last Wednesday. That's up 26 cases, but it is also down from what was our peak on the 19th of August of 808 active cases. So we're at 752 active cases. That's down overall from the most recent peak of 808. I wouldn't call that a trend, but we are certainly monitoring, and we are hopeful that we don't see another spike, although we do, as I said, we wouldn't call this a trend. This is simply, I think, where we are at this point. At the moment, we are seeing those cases fluctuate up and down over the last several weeks, and over the last 30 days, what we are seeing is the largest amount of new cases occurring between those who are of the age 20 and 39. So largest amount of new cases among the 20 to 39 age group population. And now of those interviewed, so again, this is all self-reporting. If you test positive, you're getting a call from a contact tracer. The only thing they're trying to do is identify if you've come into contact with someone who may also be at risk of contracting the virus. But for those who do answer the phone and do give us the information, 79% of Dutchess County's new cases over the last 30 days are among individuals who are not vaccinated. So 79% among those who are not vaccinated. Now, we are seeing over the last week an average of 1,770 daily tests, so 1,770 residents being tested on average. That's a 7-day rolling average. We're averaging 79 new cases daily, and that's a 7-day rolling average of 79 new cases daily. At the same time, our 7-day rolling positivity rate is now at 4.42%. Now, this was similar to what we experienced in April. And again, you'll see a degree of fluctuation. We were just at about 5% for a short period of time. We're back down to about 4.42, which, again, a little bit higher than certainly we would want to see it, but it is similar to what we were experiencing in April. We have now 463 of our neighbors have succumbed to this virus. That is up from 461. 2 additional individuals have lost their lives to the virus. And it's important to recognize that this virus is still taking lives. I certainly know the human toll of this pandemic and this virus, and I think we all know or have someone we know or a loved one who has either experienced a severe case and or been hospitalized or at this point lost their lives to the virus. We're at 463, and our hearts go out to those individual families who have now lived with this loss. We're currently monitoring 39 individuals hospitalized in Dutchess County's hospitals. And to break down some of that hospitalization data, we don't get this data with great regularity, and we want to be sure that it is absolutely consistent and accurate when we provide it to you. But 29 patients on average. So our hospitals have seen about 29 patients on average. That's a 7-day rolling average. We're currently monitoring 39 hospitalized, 29 patients on average on any given day. 76% of those patients are not vaccinated versus 24% who are fully vaccinated. So 76% unvaccinated, 24% vaccinated among those who are hospitalized on average. And that's an average taken between August 15th and August 21st. Now, of those individuals hospitalized, the age breakdown is as follows. So 25% of those hospitalized on average to date, this is that 7-day rolling average, that 7-day average, August 15th to August 21, 25% are between the ages of 19 and 54. 45% are between the ages of 54 and 65, and 30% are 75 years of age and older. Now, listen, I think it is very important to acknowledge a couple things. We are still seeing transmission among our senior citizens. Important to monitor that, important to be safe and to be responsible when we're around caring for senior citizens, loved ones, whether you're in the healthcare field or doing that as a loved one, a family member. But we also know that individuals are hospitalized for many reasons, and some of the cases that we see are hospitalized for other reasons, and they might be asymptomatic, but then test positive upon intake. Now, how those two things interact, meaning did the virus accelerate some other ailment, that is for a physician to identify, but some of the cases are asymptomatic patients coming to or at the hospital for other reasons and then being identified as having tested positive upon intake, but that's the breakdown of some of that demographic information. Now, additionally, vaccinations are on the increase. I hope that you choose to be vaccinated. I still believe it is your choice. I want you to reach out and speak to your physician, those medical professionals that you turn to, that you trust for this information, and ultimately hope that you conclude that the right choice for you is to be vaccinated. That is your choice. 73.1% of Dutchess County's adult population, so 73.1% of individuals 18 years of age or older in Dutchess County have at least received one of their 2 doses if they're getting the 2-dose vaccine. Now, as you likely know, on Monday of this week, August 23rd, the FDA granted full approval for the Pfizer COVID-19 vaccine. So that is full authorization, full approval by the FDA for the Pfizer shot. Now, it's important to know that Moderna and Johnson & Johnson are still assembling their body of science for the FDA to consider and then potentially extend full approval for those as well. That has not occurred as of yet. Now, over 2,700 new first doses were administered in Dutchess County to Dutchess County residents. So over the last week, we've seen 2,700 new first doses. Now, that is a measurable increase in vaccines and vaccination since what was a slowdown in July of this year. This is the largest, we've seen the largest rate of growth in new vaccinations among those who are 12 to 15 years of age. And that's important as individuals turn that age bracket. They're obviously some are choosing to be vaccinated. The parents are choosing to be having vaccinated, and of course, with the FDA approval, we are seeing an increase of individuals who are choosing to be vaccinated. Boosters and booster shots are readily available throughout Dutchess County for those who are moderately and severely immune compromised. We suggest that you consult with your physician. As we've said before, there's ready access to those booster shots through healthcare providers, through our local clinics. And for those who are homebound, we still provide an opportunity through our Office for the Aging and the Department of Behavioral and Community Health. And if you are homebound and are a senior citizen, you certainly can continue to reach out to the hotline at 486-3555. That's 486-3555, and or the Office for the Aging to provide some assistance. And we are continuing to administer vaccines to those who are homebound. I want to take this moment to acknowledge Dr. Neil Wythian. As you may have heard, Dr. Wythian is stepping down as Commissioner of the Department of Behavioral and Community Health on September the 10th. It has been a very long and certainly stressful year for everyone in public health. And of course, in this state, departments of health, our Department of Behavioral and Community Health has been on the front line, and Dr. Wythian has been leading that public health response here in Dutchess County admirably, and we're grateful to him. But since January of 2020, our Department of Behavioral and Community Health has been monitoring and responding to COVID-related cases around our community and then ultimately in our community. And the amount of work that's been done by this department has been phenomenal. They've monitored over 31,600 cases of COVID in the community, assembling the tracking data and offering a great deal of guidance and resources during weekly and sometimes daily conferences and calls with our area public schools, our colleges and universities, the healthcare providers, hospitals, nursing homes, faith-based community organizations, those in the intellectual and developmental disabilities community, along with private and public sector employers and private businesses. The department, under Dr. Wythian's leadership, has mobilized hundreds of Medical Reserve Corps volunteers, and we've seen a massive increase in the number of residents who've come forward to provide volunteer assistance, and we're grateful to each and every one of you. The department itself has been providing a great deal of support and assistance to a whole host of organizations, coordinating with our Department of Emergency Response, the distribution of protective equipment and information and resources to be of assistance, guiding together with local providers public outreach, responding to the media, responding to emails and calls and even Facebook messages to county government, and propping up, establishing, and administering our call center, which has been a tremendous resource. And this department has done just so much work. And I can only say this, we are tremendously grateful to everyone who's worked in the Department of Behavioral and Community Health. Certainly over the course of the now 10 years that I've been county executive, but these last 20 plus months, we're certainly grateful to each and every one of them. And Dr. Wythian has led through it all. His calm, professional, and capable address and response to this pandemic and his very steady presence has served us well, as has his over 20 years of experience in infectious disease. And as an infectious disease doctor himself, he's been a tremendous resource. Now, he leaves the Department of Behavioral and Community Health stronger than ever before. It is one of our largest departments, with among the largest responsibilities, from environmental science and response to environmental health concerns to public health, broad public health, and of course our behavioral health. And that department does tremendous work in both public and behavioral health throughout Dutchess County, really redefining the way in which we do it here in Dutchess, but also as an example across the state of New York and this country. I am, and we are, tremendously grateful to Dr. Neil Wythian for his leadership and his service these last years, and I certainly ask that you join all of us in wishing him well in the next chapter of his life. It has been a long 20 months, and we understand his desire ultimately to begin a new chapter, and we're grateful for his service. That's the update that we have today. As information becomes available, if things change, if we have a degree of concern or response that we think is necessary to speak with you, we'll be back certainly sooner, but I hope to give you another update at some point next week based on based on the data. In the meantime, though, do enjoy this weekend. Be safe, keep healthy, and be kind to each other.